many folks coming in, so come on in, get comfortable. Welcome to our webinar today, hosted by SAMHSA's Game Center, with the support of SAMHSA, which is the Substance Abuse and Mental Health Services Administration. And our webinar today is Bridging the Gap, Linking Individuals to Recovery Support Services. And our presenters today are Kim Govak and Roy Mellinger, and I'll introduce them shortly. I'm Dr. Melissa Stein, a Senior Research Associate at Policy Research Associates in SAMHSA's Game Center. I'm joining, I go by pronouns she, her, and am joining from Charlotte, North Carolina. So for all of you coming in online, feel free to put in the chat where you're joining from, what organization, what part of the country. Thank you so much for being with us today. Next slide, please. The views, opinions, and content expressed in this presentation and discussion do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Center for Substance Abuse Treatment, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. Throughout our presentations today, we welcome your questions, and you will see at the bottom of your screen a Q&A pod. Click on that and enter in as many questions. We'll answer those questions at the end of the presentations and get through as many questions as we can. You'll also see a couple of polls pop up throughout the presentations. So when you see that, just select your responses, and we really appreciate your participation. You should have just seen a poll pop up, so you can select and submit your responses. Next slide, please. We are recording this webinar, and we will share the slides with anyone who has registered for this event. We will also share the URL when this webinar is posted to SAMHSA's YouTube channel. At the end of our presentations, we will make available a certificate of attendance, and this is for your personal portfolio use only, and we're not able to provide CEU credits. We have arranged for ASL interpretation. Our interpreters today are Paige Bitsky and Lauren Burr. We also have live transcription available through Zoom. In order to see that, click Live Transcript CC and then select Show Subtitle. Just a quick look at our agenda today. We're going to have some opening remarks from John Berg at SAMHSA, and then move into our presentations with our representatives from Faces and Voices of Recovery. And then, as mentioned before, we will close with time for Q&A. But first, I'd like to hand it off quickly to John Berg to provide opening remarks on behalf of SAMHSA.
Great, thank you, Dr. Stein. Welcome and good afternoon to everyone to today's webinar, Bridging the Gap, Linking Individuals to Recovery Support Services. Thank you all for taking time from your busy schedules to participate in today's webinar. SAMHSA is very pleased to provide this webinar that focuses on recovery and the importance of linking individuals to recovery support services in their communities. I would like to share about an important resource for those working in the area of recovery support services. SAMHSA's Office of Recovery was established to evaluate and initiate policy, programs, and services with a recovery focus and ensure the voices of individuals in recovery are represented. The office supports the growth and the expansion of recovery support services across the country. It is a national clearinghouse and resource for recovery-oriented care across the mental health, substance use, and co-occurring domains, and promotes a recovery-oriented system of care working in partnership with recovery community leaders. I will add the link to the Office of Recovery in the chat once I'm finished here welcoming you. And you can also search for, all you have to put in is SAMHSA Office of Recovery, and it'll come right up. SAMHSA defines recovery as a process of change through which individuals improve their health and wellness, live self-directed lives, and strive to reach their full potential. A person's recovery is built on his or her strengths, talents, coping abilities, resources, and inherent values. It is holistic, addresses the whole person and their community, and is supported by peers, friends, and family members. The process of recovery is highly personal and occurs via many pathways. It may include clinical treatment, medications, faith-based approaches, peer support, family support, self-care, and other approaches. Recovery is characterized by continual growth and improvement in one's health and wellness and managing setbacks. Because setbacks are a natural part of life, resilience becomes a key component of recovery. Recovery services are critical to support the recovery of individuals involved with the criminal justice system. However, it is not always clear how to connect people to the services most appropriate for their needs. Today, our speakers will cover what assessment tools exist in the field for identifying an individual's unique strengths and needs, and how to leverage that information to connect individuals with the most appropriate recovery services. Approaches for creating relationships and partnering with recovery support providers in the community will also be discussed. We are pleased to have two great speakers present today on this very important topic. I want to thank Kim Govak and Lori Mellinger for sharing their knowledge, expertise, and experiences today. And as always, I want to thank the Gaines Center and their staff for their work in developing and facilitating today's webinar. So at this time, I'll turn it back to you, Dr. Stein.
Thank you, John. And now I'd like to quickly introduce our presenters today. Kim Govak is a woman in sustained recovery management. She is a national certified peer recovery support specialist and certified peer recovery specialist, and has been trained in community reinforcement and family training, which is the CRAFT model. Kim has had the honor of being the director of a regional recovery community center in southern New Jersey, and has trained many individuals to embark upon careers within their recovery support sector. She's currently a program manager with Faces and Voices of Recovery's Council on Accreditation of Peer Recovery Support Services. Kim was chosen to serve on the National Center for Advocacy and Recovery for Behavioral Health's Board of Directors, and was a founding advisory board member of the New Jersey Coalition for Addiction Recovery Support. In July of 2023, Kim will finish the coursework necessary for a bachelor's degree in behavioral health sciences. Her motto is "Recovery is possible for everyone." Lori Mellinger is the training program manager for Faces and Voices of Recovery. She is a former newspaper reporter and editor who, in the midst of a long-time substance use disorder, became entangled in the Texas criminal legal system. It was in prison that she discovered a passion for reentry and the complex issues that women face reintegrating into society from incarceration. She spent her first 7 years post-incarceration in direct services to women in and out of incarceration, and has worked with upwards of 1,000 women. A person in long-term recovery, she began working at Faces and Voices of Recovery in the National Recovery Institute in 2022. Trained as a reentry, mental health, and recovery peer specialist, Lori also has extensive nonprofit experience, including programs, grant writing, advocacy, and strategic planning. A strong believer in servant leadership, she also believes that community solves everything. She serves on the steering committee for the Statewide Leadership Council, the coalition of the Texas Center for Justice and Equity, and is also active in the Austin Reentry Roundtable. In 2023, she co-founded Lioness, Justice Impacted Women's Alliance, and she is a member of the 2023 cohort of Just Leadership USA's Leading with Conviction. She lives in Austin, Texas, with her 2 pets. So thanks so much to our 2 presenters. Really looking forward. So without any further delay, I'm going to turn it over to, actually, I think we're going to get the results from our poll. So here we go. So you've heard who is presenting today. So let's take a look at who's joining us today for our presentation. Right now we have a majority, almost 50% joining from urban locations, followed by 34% joining from rural areas, and about 20% joining from suburban locations. We do have a handful of you joining from tribal lands. And then in terms of organizations, we have a majority of you joining from community-based provider agencies, followed by about 15% of you joining from corrections, probation, and parole. We've also got a good number of you joining from government and policy, as well as public health. So thank you so much to each and every one of you for spending your time and your afternoon with us. So now, without any further delay, I'm going to turn it over to Kim Govak to start our presentation.
Thank you, John Berg, for your opening remarks. We thank you for inviting us here today. And thank you, Dr. Stein. On behalf of Lori Mellinger and myself, we would like to thank SAMHSA Gaines Center for Behavioral Health and Justice Transformation for the honor and opportunity of presenting on Bridging the Gap, linking individuals to recovery support services. I can tell you that as the former director of 3 recovery support centers in Southern New Jersey, I have had the opportunity to speak to a lot of peer recovery specialists who have the honor of working in this space, and they have all stated what an honor and privilege it is to be able to work with this population. So I wanted to make sure that I shared that. Also, it's great to see so many people from across the country and in Guam. Welcome, everyone that is from different spaces, different sectors. I'm going to start with some statistics here. At the end of 2021, there were approximately 1,204,300 individuals who were incarcerated. Approximately 65% of that population has or had an active substance use disorder. Of that population, 27% of these state individuals and 14% of these federal individuals stated that they had received notification or diagnosis of a major depressive disorder, which was reported as the most common mental health disorder in incarceration. It's important to note that even though these are statistics, each and every single person that is reflected here, is a person. These are individuals with lives. These are individuals who are important, and these are individuals who deserve support in being reintegrated into their communities. Currently, depending on what facility an individual is incarcerated, the participants are incarcerated. And I wanted to caveat this by saying, across the country, peer recovery support specialists have different titles, right? So in some states, they may be referred to as recovery coaches. They may be referred to as peer specialists, peer recovery support specialists. For the purpose of this webinar, I'm just using the terminology peer recovery support specialist or peer. And individuals who are receiving services while incarcerated, I'm going to refer to them as participants, because these are individuals who are participating in services for the most part. So currently, for substance use disorder, depending on where the individual is located, they may receive these services: screening and assessment, substance use programs, medication management, or peer recovery support. If they have a mental health concern, they may receive screening and assessment, psychiatric care, individual group therapy, or crisis intervention. So these are all wonderful services that we have the opportunity to provide, and they have the opportunity to participate in. But what happens for these folks when it's time for them to be reintegrated into their communities? What does that look like for them? Research suggests that regarding policies, I'm going to read this slide because this information is important. Regarding policies for reintegrating participants back into their communities, reentry starts in prison. Rapport building challenges should be viewed as or reviewed as feasible for participants and peer recovery specialists to get to know each other. Always with security and safety in mind, participants on the road to recovery should be encouraged to volunteer while incarcerated, if at all possible. Community service providers who will be working with these participants after they are released should contact them while they are incarcerated to begin the rapport building process. The significance of these concepts here is to create opportunities for participants and peer recovery specialists to build a relationship that's established and founded on trust and understanding. It cannot happen if it's 2 weeks before the individual is about to be released. So ideally, it should happen well before that time. How do we create opportunities? Creating opportunities. Referrals should come from within. In any peer relationship, in whatever sector the peers are working in, the rapport building is paramount to the relationship. So when the referrals come from within, and they come from within the facility where the individual is, that is the first establishment of a rapport building, because it is cementing the idea that the facility is interested in the participant's success. So by making these referrals to peer specialists or to programs that are providing this service, they are implementing the idea that they are invested in this individual's success. There should be time for the participant before they are released to begin working with a peer. For continuity of care, there should be an agreed upon time that the peer will be working with the individual before they are released and after they are released. The idea here is, and the investment is, before release, the participant has an opportunity and a time to work with the peer on establishing any goals that they may have for themselves when they are released from incarceration. And pursuant to that release, they can reevaluate any goals that they have discussed while working with the peer recovery specialist and any new objectives that they may have to establish upon release. The peer to participant relationship. Peers can initiate introduction. So upon receipt of the referral, the peer recovery specialist can confirm that they received the referral, right? So there's nothing else that's like worse than sending off a referral and never knowing if it landed where it was supposed to go. So ideally, the peer wants to reach out to the person who provided the referral and say, I got it, and I'm going to initiate conversation. They have the opportunity to discuss the services that will be provided. The beginning of rapport building is that the peer shares about the services that are offered and asking the participant if they would benefit from these services. It should not be understood that this individual is going to want to participate. There should be a robust conversation about what can be offered, and then offer that individual the choice of participating in reentry or reintegration in the reintegration services. Agreement and consent. Upon agreement, the peer may share a little bit about their experience with recovery, with justice involvement, or with reintegration into the community. Ideally for peers, this conversation does not have to be led with the peer specialist's lived experience. It's more about active listening to what the participant would like to achieve and how the peer specialist can incorporate their lived experience into helping support this individual. As far as assessments go, non-clinical peer recovery support specialists do not do traditional clinical assessments, but they may have paperwork and documentation that they are responsible for that can be determined by the host agency or the organization that they are working with. I wanted to note here that in order to help build the rapport, peer recovery specialists have been trained to employ authenticity, empathy, and active listening in order to create a brave space for these individuals to open up, feel understood, and more importantly, feel heard. They approach the peer to participant relationship with respect, honoring these individuals' autonomy and their personal choices in a non-judgmental manner. That's so important. is to honor these individuals' personal choices and what they want to do and the first things that they want to be supported in when they are being reintegrated into the community. I can tell you that I'm in South Jersey. And in the state of New Jersey, the reintegration program is called Reentry, and they're funded by the Division of Mental Health and Addiction Services. And the Division of Mental Health and Addiction Services requires documentation and also requires that individuals who are a part of the reentry program are registered as participants for these services. We all know how important data is, but it's also important to keep contact with these individuals and to make sure that there is a continuity of care. Recovery support services. This is the life's bread of this program. So for many individuals with a substance use disorder in general, there is a stigma that exists, and it remains paramount, and it remains a challenge for individuals with substance use disorder in any space. These individuals also may face limited, especially the ones that are being reintegrated into society, may face the challenges of limited employment prospects, inadequate housing options, and most importantly, disrupted social relationships. So the peer specialist has an opportunity to set up an introduction with these folks and share their lived experience in order to try to create a successful transition for these individuals into back into their communities. And they can use their experience-based support. By leveraging lived experience, peer specialists can be instrumental in ensuring a successful transition and reintegration into the community. John spoke earlier about linkages and the importance of linkages. We say that in the recovery space, we like to say that the opposite of addiction is connection. I'm pretty sure many of you out there have heard that. So peer recovery specialists can do a variety, they can provide a variety of services. They can coordinate medical appointments. They can coordinate linkages that are required for these individuals as far as social determinants of health. They can provide resources for educational assistance because that may be a goal or an objective that these individuals may have. And in some programs, they may also be able to provide transportation. Peers who work with individuals who are working towards reintegration can help by connecting these individuals to services. I also want to say here that it is important for peer recovery specialists to be consistent and reliable in their support. And they can do that by being dependable and keeping their commitments and following through on any agreed upon actions that they have with these individuals. And what this does is this continues to build the trust, this continues to build the rapport with these folks when they are reintegrated into society and into their communities, and continues to be a bridge of support for these individuals. In New Jersey, in some programs, the peer specialists are able to provide the individuals who are being released with a go bag. Has anybody ever heard of a go bag? Right, well, here in New Jersey, the go bag or resource bag can consist of resources like a phone, which is so important for these individuals to be able to keep up with their appointments. There may be identification to help facilitate their engagement with social services or any other types of appointments that they may have. These go bags can also include toiletries and other essentials. Most importantly, and what we'll talk about a little bit later, is resources for these individuals. This is what John talked about building partnerships with providers in the community. So the first line here is outreach, outreach, outreach. It is so important in order to establish collaborative relationships that service providers must know the individuals who are providing the services and the programs and organizations that they are associated with. So the way that this is done is by letting people know that the services are available, leaving flyers behind, leaving information behind, leaving contact information, sharing about what our reentry and reintegration programs are able to do for folks across this nation, and making sure that a positive affect has been left for the providers so that they're willing to have that community buy-in to assist these individuals. So outreach is very, very important in establishing collaborative relationships. It's also important, we are in such a great space here in the United States to have recovery community organizations and recovery community centers in many of our states. In New Jersey, we are very, very blessed to have recovery community centers in all 21 counties. So for the peer specialists that work here with individuals who are incarcerated, one of the first things that they should be working on is identifying local recovery community centers and organizations that can provide non-judgmental recovery support for these individuals. And that can include if these individuals are experiencing food insecurity, if they just need support, if they want to attend any types of support group meetings, if they want to have just a one-on-one conversation, or if they just want to be in a safe space. Initiating a participatory process, which is a one-on-one between key community partners and providers who are interested in participant reintegration and can share mutual goals, areas of collaboration, and suggestions for any challenges that may be incurred is important. When I talked earlier about some of the resources that can be given to individuals in their go bag or whatever resources they are going to receive upon release from incarceration, one of the things that we talk about and is very important is the harm reduction sphere. Research shows that the risk factor for overdose includes a decrease in tolerance while individuals are incarcerated. So in the first 4 weeks post-release, there is a higher risk of drug-related death for these individuals. Drug overdose is the leading cause of death following release from incarceration for individuals with substance use disorder. And what happens here is that, coming out of incarceration, some individuals may just want to celebrate their being released, and unfortunately, they may run into the consequence of experiencing an overdose. So hopefully, working with a peer specialist beforehand can cement in them the idea that they do not have to return to use, right? If there's a peer specialist that's working with them and that can be involved in their release and making sure that they get from point A to point B in their journey, that is so important to help decrease the opportunity for them to have a recurrence of symptoms or a recurrence of use. In New Jersey, the peers that work in the reentry program provide participants with the most current information on any harm reduction centers, harm reduction support services that can be offered to them, and any recovery community centers that are nearby, and also information on the closest emergency rooms. It cannot be, it cannot be discounted that an individual may have, they may have a opportunity, or they may run into a situation where they do have a recurrence of use, and so therefore they need to be provided with this information beforehand. Participants are also provided with information on where they can receive free naloxone. And it is also important to share with these individuals any laws that may be out there for their protection. One of the laws that we share information on is the Good Samaritan Law, which in the state of New Jersey is if an individual is engaged in substance use disorder as far as opioid use disorder, and they're with someone who is experiencing an overdose, they can call law enforcement in order to get these individuals help. So it's not so much as a punitive, it is more providing services and providing an opportunity for this individual to receive help, to be taken to the local emergency room, or to have emergency services dispatched. And most of the emergency service programs are carrying Narcan and or naloxone and have been trained in administering it. So my closing thought here that I would like to leave everyone with is, in the role of a peer recovery specialist, working with individuals who are incarcerated, we can be a beacon of hope, understanding, and transformation. Through our lived experiences and unwavering support, we can guide and empower participants in a strength-based way. John talked about recovery-oriented systems of care, strength-based, person-centered support and encouragement. We can guide and empower participants to reclaim their lives, overcome any challenges that they may have or the challenges that may be in their mind, and help pave the way for their future together. And that means every single one of us that's on this webinar today. It means that you have a vested interest in this population, in these individuals who so deserve our help, right? Together, we can break the cycle of addiction. We can inspire resilience, and we can create pathways to successful reintegration, one life at a time. I would like to express many thanks to the SAMHSA Gaines Center for Behavioral Health and Justice Transformation. I would like to express my thanks to Faces and Voices of Recovery, who we are championing work in this space, and to all individuals who are working with folks who are incarcerated and seeking to help pave the way for their successful reintegration into their communities. I would like to introduce my beautiful colleague, Lori Mellinger, who will impart her lived experience and the hope of recovery. Up to you, Lori.
Thank you. Thank you so much,
Welcome.
Kim. It's tough to follow someone with so much wisdom and so much passion, right? And I'm super honored to be with all of you today. I'm from Texas. I'm a lifelong Texan, y'all. So you will hear me say y'all a lot. It's just part of my vocabulary. And again, I wanted to thank SAMHSA. I wanted to thank the Gaines Center. And I wanted to thank you all for coming and giving me the opportunity to share my experience. You know, last week I was in Denver for a national conference of city and county health workers, right? And there was a lot of harm reduction on the table. There was a lot of people from all over the United States, such a cool group of people who were thinking about big things, right? Talking about racism as an epidemic, talking about harm reduction, things that I don't know about you guys, but I haven't always seen in my lifetime. So I was in a ride share going back to the airport Thursday afternoon and kind of reflecting on the conference. Of course, I was a little anxious to get to my flight, but I was listening to the driver as she told me, apropos of really nothing, that she had sympathy for alcoholics, but not drug addicts. And it was just kind of that stark reminder of what I just left, and how sometimes I think that when I do this work, I get very siloed and I start thinking, well, I mean, everybody thinks the same way I do. And guys, I think y'all all know this, that isn't always the case. So I have a friend who wears a t-shirt that says, all my homies went to prison. And I always think, yeah, mine too, because my community of support and the people who I rely on and the people who really have stood by me this whole time have really probably 95% been impacted by the criminal legal system. So I had a choice to make in that moment, right? Could I open up this conversation with her, or do I just let it ride? And I'm going to be honest with y'all. I probably took the coward's way out and I just let it ride. I was wanting to get home. I was tired. I just didn't want to engage. But the truth of the matter is, do I really look like somebody who's been to prison? Because What does that really look like? I guess I can pass for somebody who's never been behind the walls. But y'all, I lost my freedom in the fall of 2013. My TDCJ number is 1911204. I've been in long-term recovery since I went to jail one night in Tyler, Texas. And I went to prison so much later than a lot of other people do. Part of that probably stems from some privilege that I have. And part of it was just because I learned early on to split myself into two distinct people. One that kind of lived up to other people's expectations of me, and one who was trying her darndest to escape from all of that. You know, I grew up in a very small town. My graduating class, if it gives you any context, was 215 people. We were religious, we were conservative, and most of us were pretty poor. And, you know, I lived a double life for probably as long as I can remember, starting when I was a teenager, continuing into my adulthood, and really kind of walking that balance between not doing everything right and not doing everything wrong. I got pregnant. I was a single mother. I always joke and tell people I was on the cusp of single motherhood, right before it was so much more prevalent that I was kind of, it was still very stigmatized in my hometown. I moved back and forth between Houston and this small East Texas town and just really tried to find where I fit and just really couldn't. So I tried everything. I tried getting married. I got a good job. Like they said in the introduction, I worked at a newspaper. I worked my way up. I worked my way up as an intern to one day I became the newspaper editor. And somewhere along the way in that same time, I tried 12 steps for the first time, but I also tried benzos for my anxiety for the first time too. And in that time and in that space, those two things didn't coexist in a recovery realm. So eventually, even though I was married and had this upstanding job, I started falling more back into my substance use, my alcohol use, and things. I mean, what do you guys think? Things fell apart, right? My involvement with the criminal legal system didn't really, I mean, it started in my 20s, but for any of you who have been impacted by the legal system, there's usually some steps to this, right? And so I explain the steps as I would get arrested, I would sit on the bench where I book in, I would wait to make bail, and then eventually I would rack up some charges where I couldn't make bail, and where maybe I had to spend the night, and then maybe I had to spend a week, and then a little bit later, it was a month. So when I got a divorce, I lost my career and I lost custody of a child, and it happened in pretty quick succession, like probably all in 1 year. I probably got tired of really trying to hold all that together. So one night, and I remember it so clearly, I was at the intersection of Loop 323 and Highway 64 in Tyler, Texas, and the police pulled me over for not signaling to get into the left turn lane. And I had two thoughts in super quick succession. The first one was, I'm going to prison. And the second was, just thank God, I'm so sick of this. I'm so tired. And I was, and y'all have to excuse me, you know, I'm saying a lot. I'm trying to keep it slow, but it also makes me very thirsty. So in early 2014, I was arrested in 2013. I spent some time in county jail. And early in 2014, I pleaded to and I agreed to serve 6 years in the Texas Department of Criminal Justice. I wish I could say that I made up my mind then, but it took me just a little bit longer. And I used to say, y'all, that prison saved my life, but I want you to know that that's not true. Prison kept me away from society, Well, my mind cleared and I was able to finally make that decision that I didn't want to live that way anymore. And because I had a very intimate and a very spiritual experience in the last year of my incarceration, I said, I surrendered everything and decided to change my entire life. But you know, what wasn't clear to me was what to do from there, because I heard Kim say, this is the name of the reentry program in the New Jersey prison system. And here's what I know. There is no real reentry program in the Texas prison system. People are making inroads to that. People are being trained inside as peers. And even the director of reentry for the Texas Department of Criminal Justice really wants to integrate peers into her workforce. But here's what I also know. There's no reentry that happens on the outside by the state system. Every bit of reentry work that is done on the outside of prison is done by charity, nonprofit organizations. So I never heard of peer support. I had never heard of reentry programs. In prison where I did time, it was mostly a lot of faith-based programming and some 12-step work thrown in. So in the face of having no other choices, I took charge of my own reentry. I did math on how long I was likely to serve, because in prison, in Texas prison at least, you don't serve your entire time. It's likely there's all sorts of determining factors. So I did math on how long I was likely to serve, on my ability to make parole. I took advantage of the community there and asked people where they were going, what they were doing, and how they were going to make it on the outside. Information inside is such a big commodity. It's probably our currency. It's money. We passed it along so that we could help one another. So I was released on September 10th of 2015. And I always say, I got a check for $50 from the system, and they told me to go forth and sin no more. 85%, I heard Kim's statistics and I was very interested in that. I think she said 65% of people incarcerated across the United States, but I can tell you from my work in reentry that 85% of the women incarcerated in Texas are there as a direct result of alcohol and substance use disorder, whether their paperwork says that or not, whether it's burglary or habitation, dialing back to substance use, whether it is any number of crimes, theft, or any of those things that are dialed back to substance use. 85% of the women's population in Texas is there for alcohol or substance use. And in that time and figuring out my own reentry, that's when I knew I found my purpose. No one I knew called it peer support, but I found a transitional housing program that I went to. And what I can say in retrospect, and even as I've seen a lot of these women take the peer training and make their life and work as peers, is that's kind of what we were all doing for one another. We were doing it without the formal education, which I don't always recommend. We were doing it maybe without the boundary and the ethics training and all those things that you should have. But we were just a bunch of women walking out this new life together. So it was there that I was able to find my calling for the next 7 years. And I helped build a program around reentry services for women coming out of incarceration. When I first got there, I have a very dear male friend who's in prison. He still is. In fact, he gets out in a month. He's been there the whole time. He got locked up a week after I did. And so when I first got to this program, I did what a lot of people do, and I wasn't happy and I wasn't comfortable because it wasn't home and it was hard. And I'll never forget what he wrote to me in a letter. And he said, if you don't like this situation, then build you an army. And so that's what we started doing. We built an army of formerly incarcerated women that reached back in and helped the women who were coming out, because I heard what Kim said too, when she said reentry doesn't start right before you're released. In fact, we in Texas say that reentry starts on day 2 of your incarceration. It was at this transitional housing program that I began writing letters. We did what we call pre-entry. We knew that reentry it started inside. We untangled a system of nonprofits in the town where I lived. We asset mapped. We didn't even know what this stuff was called. We just did it. I used evidence-based reentry principles taught to me by the founder and the director of the program, even though I don't think either of us knew what these evidence-based practices were. We did them. We didn't know they were called that. We just knew what worked and what experience had taught us. We made resource lists, second chance employer lists, and we built a community of support. And it was my roommate that ended up introducing me to peer support about in 2017 in Texas. And it was still very scarce and very hard to come by. She secured the training. And what we did, I built the foundation for the program with tracking systems, grant writing, fundraising, program building, because what I know and what you guys probably know too, is the need is not diminishing. And I learned from her the tenets of peer support before I was even trained as a peer. And she began navigating our women into peer services. We used what she learned to build a system of peer support through the 4 houses in the apartment building owned by that program. And when I walked away for another job in 2020, I am proud to have left behind a foundation that is built with sustainability. That program will likely last forever, and I hope so, because I believe that in many ways it saved my life. I went on to build another reentry program, a reentry program for an organization that did entrepreneurial training inside and outside the prison. And I also began going back into the same unit where I was incarcerated 4 days a week. I was trained in trauma-informed care. I was able to meet each woman where they were, person-centered support with a trust that you guys know is only built from walking the same path that they too walked. And like they said in my bio, I'm proud to have worked with about 1,000 women in and out of prison. I not only wanted to give women the support that in some cases was never given to me, but through a combination of advocacy and storytelling and walking alongside women in and out of prison without judgment, like Kim said, and without shame. We are building a movement. We, the formerly incarcerated, are building a movement, not only across Texas, but across the country, formerly incarcerated people and returning citizens who aren't willing to accept this status quo. We're fighting for and we're fighting alongside the women that we left behind. We were told in our first week in prison and over again, you came here alone, you're leaving alone. And we have proven them day after day after day that that's not true. So and wrap up my experience. And I left this last job that I built a reentry program for in 2022, of July of 2022, and came to work at Faces and Voices in later that year. And I'll tell you what drew me to this work was that intersectionality between incarceration and substance use disorder, and how I could use my lived experience to not only inform people of the complex reentry of women in prison, but of reentry struggles and obstacles as a whole. And so I wanted to give y'all a list of what I feel like are the biggest systematic hurdles of living with a criminal background. And Kim mentioned some of these hurdles with employment, including job and being severely underemployed, hurdles with licensures, hurdles with housing. I still fear looking for a place to live, and I go to extreme lengths to balance that out with good credit, good employment history, and great rental history. The complex trauma that most people in my shoes have experienced and how to deal with that. Access to mental health resources, medication, community support, and y'all laws that separate and further stigmatize. In Texas, until the year 2015, SNAP benefits were not allowed to people with drug offenses. You could have a burglary of a habitation charge, but as long as it didn't say drugs, then you could get food stamps. But anything that said drugs, you could not get food stamps. And I want to ask something of all of you, and that is how people turn their experiences into their superpower. And this is what I know, and this is what my friends say too. It is a beautiful time to be a system impacted person in this space. We teach people how to tell their stories in a strengths-based way, help people with system impact know how to go do this in a job interview and in all these ways that matter. Learn how to provide that loving community where others are encouraged to live out loud. And y'all challenge your biases. And I want you to hear me when I say this one. Challenge your biases. Do you separate when you're working with people? Do you have a tendency to separate one crime for another? Do you understand the history of the prison system and the systematic racism that goes with that? And you guys, I'm sure you're doing a great job helping where you can, from IDs to socials at the beginning of the release to help with transportation, compliance with supervising authorities, self-advocacy, and education. But also open your minds to think about those near impossible resources to find: dental care, second chance landlords, career tracks where their voice is not only accepted, but has value. And recognize that tangibles aren't the whole thing. Just like those of us who are in recovery, without system impact, the beauty and value of a safe community cannot be overstated. And Kim spoke to that earlier. Provide that safe and inclusive environment. And at the end, you guys know that community, and I've been taught this, solves everything. My asks as I finish talking today: keep advocating, keep educating, and keep changing hearts, sometimes one person at a time, and sometimes in unexpected places, maybe like a ride share on the way to the airport. Speak up, use the power of your story, get system impacted people involved at your organization and at your tables. Make it safe, let them lead, let them showcase their subject matter expertise. And that's all I've got. I want to thank you so much. It's tough, you guys. It's tough to tell your story. And I'm an introvert, so it's tough for me to talk at all. And I'm going to hand it back to Melissa.
Thank you so much. I would have no idea that you're an introvert, Lori. Well, thank you so much, Kim and Lori, for your presentations. And so now we have some time for Q&A and diving even deeper into some of these topics. So I want to kick us off and really walk us through maybe some more of the practical application kind of questions. And then we've got a few questions about naloxone and different things in the Q&A pod. So so I'll just pitch this both to both of you, Kim and Lori. So we talked about the in-reach piece, getting folks connected, the pre-release planning, I'm forgetting the term you used, Lori, but I thought that was a really cool term. And I think what sometimes people struggle with, how do I know what services people need? And so there are a number of tools out there, assessment tools or screenings, or some people don't use a tool at all. They have more of an internal process. But what would you all recommend in terms of any tools or strategies to making sure that you can assess folks and link them to the services they might most critically need right there at that reentry point, knowing that those needs are going to evolve as they transition, but at that critical piece of reentry and release from prison, how do you identify the needs that people will have in order to connect them with services? Whoever wants to dive in first to respond to that, go ahead.
I'm gonna let Lori take that one.
I'll take that one. First of all, pre-entry is the word that I used, and I stole it from somebody else. So you're welcome to use that. But honestly, y'all, I rely on basic needs. I work my way through Maslow's hierarchy of needs. It's how I built the reentry program that was inside out, and kind of use different assessment tools. Not sure if I'm supposed to say this or not, but I've never used an assessment tool because the people that I know don't trust them and are less likely to be honest on them, unless of course it comes from a trusted source. But I definitely use very person-centered, very much listening, very much the women who I've worked with will joke with me and say, tell me what that looks like, because I used to say that all the time. I allow women to walk through things, and we walk through them together.
Kim, is there anything you want to add to that?
Sure. So what I was going to say, I mean, first of all, I have got to say, Lori, what a fantastic job that you did with sharing your story. Thank you for setting the tone for what this really looks like in the real world in 2023 and what's being experienced across the country. In the chat, they were talking about, thank you for risking your vulnerability. Thank you for all the things that you're doing for the community of Texas. Thank you for doing the women, for helping the women and continuing to go back and give back to your community. And I wanted to make sure that you saw that, because I don't know if you had a chance to look at the chat, right? So just as Lori said, a holistic approach to working with individuals who are incarcerated does not necessarily involve a formal assessment. These services are based upon emotional support. They're also based upon practical guidance. Individuals who have gone through incarceration and been reintegrated into society use a lot of their own experiential services, right? Their own experiential resources. And so I think it's important to talk about what support would look like for those folks, because as Lori said, building that out in Texas, there are some states that have reentry or reintegration programs. So in order for the peer recovery support specialists to continue to be supported, it is important that they receive training and education. It is important that they have supervision and support from their supervisors. It is important that the peers, that an eye is kept on these individuals, right? It's just like with any other peer, because they may be experiencing vicarious trauma. They may just become overwhelmed. So just keeping an eye on how they're doing, and as evidence-based or more assessment tools are reviewed, especially by some of our programs that SAMHSA mentioned earlier, that John mentioned earlier, the Office of Recovery. As we continue to do this work, more evidence-based support will come out, more ideas of what a non-traditional, non-clinical assessment will look like for these individuals. But it's important to note that peer recovery specialists, the peer recovery relationship is built on one-on-one. It's built on trust. It's built on meeting them where they are, and it's built on establishing the goals that they have for themselves, right? The goals that they're setting for themselves. Ideally, we all have a plan on what they should do when they are reintegrated into society, but what do they want to do? So if we're talking about this from a holistic perspective and what they want to do, there's no assessment tool that can define what an individual is going to want to do when they are reintegrated into society. For some people, it's going to be seeing their kids, like immediately. Like, I want to see my children. I want to see my family. What does that look like, right? For some, it may be I have some medical needs I want to take care of. Right? I'm not sure that is something that can be assessed. This is something that's on a holistic, person-centered, strength-based, honoring the autonomy of that individual and what they want to achieve.
And we recently had a webinar where one of our presenters talked about the 8 dimensions of wellness, and that being another kind of paradigm or framework that people can use to walk through, okay, what might be your needs among these 8 dimensions, and how can we make sure that we're addressing all of your needs? Because we also know that people feel overwhelmed at release, and they may need help thinking through, okay, maybe my priority is that reunification with my kid. Absolutely, that's the only thing on my mind, but in order to make that successful, we also have to address the substance use, and that might not be something that I know much about. So we definitely want to provide people with the structure they need to think through all the things that need to happen and come together to support that recovery. So thank you for that. And I really do appreciate having a flexible approach to this, having an approach that works for the individual. Yeah, I see in the chat, people are agreeing with that, have a conversation, not an assessment, etc. Thank you for that. So, you might have a similar response to this, but I also want to ask about frequency. So I do hear you said that the peer support specialists, they're in a relationship, so there's going to be conversations. But for organizations that might be new to pulling together peer support teams, what is guidance around the frequency of checking in on people and reassessing what their needs might be as they release from prison, and then after a period of time as they transition? How often should we be having these conversations with people to assess what their needs are and make pivots accordingly? That's for either one of you, Kim or Lori.
Well, if I could have my ask, a year at least, 6 months fundamental, or at least a year if programs can allow that. Ideally, working with individuals as much as possible, providing check-in opportunities. I believe in the state of New Jersey, and I'm so grateful for the boots on the ground here. They check in with the participants weekly. They establish recovery plans with them. And we were talking earlier about assessments. They establish recovery plans or wellness plans. And what that does is that gives the individual a framework of what they can work on, because as Melissa, as you said, their first thought may be to want to see their children. Okay, but what's in their recovery plan to lead up to that? And what that does is that establishes continuity of care, because it establishes the opportunity for the peer recovery specialist to reach out to the participant in an established time frame, right? So it also gives the individual, if they don't hear from them, they have a reason to call, they have a reason to check up on them, to follow up on the goals that they have established. So I always say, if we can give them a good 6 months, if we can check up on them weekly, make sure that it's documented, so in case the peer specialist is out, we know that this can happen sometime, someone else can make sure that that person is followed up, right? So have those kind of systems in place where they can be contacted as much as possible. We talked about how tolerance goes up. We talked about recurrence of symptoms. So in order to kind of cocoon these people, if our systems could provide services at least 6 months with a weekly contact, I would love for them to be able to see services for a year. And then if they continue to need it, how about they get another check-in and say, let's extend this for another 6 months, right? Or if that can't happen, refer them to their local recovery community organization or recovery community center that can follow up with those services.
Lori, anything else you want to add to that?
Yeah, well, first of all, Kim did such a great job answering that. And I know she said, she gave a statistic, and maybe you can repeat it in a minute, Kim, because I don't want to get it wrong. But you said something about risk when you were released. But so from what I found working with people, being in prison and working with people, I have my little benchmarks, right? I like every day for the first 2 weeks, because I feel like you're most vulnerable the first 2 weeks. Then seems like you get a little vulnerable 3 months in, definitely somewhere between 6 and 9, and then again at a year. As far as peer support services go, it is a relationship. So you are trying to engage for, longer than kind of a longer time necessary. But as far as data and tracking that I've done in reentry programs, we follow the lead of the DOC. So Texas does a 3-year measure on recidivism. Any reentry program that I've built has followed women for 3 years, just to get the same data that they have.
That's a really helpful point to really think about the data piece and let that inform how many of our listeners are shaping their program and following up with people. So thanks so much for that idea. And just a reminder, folks, if you have questions, drop them into the Q&A pod, and I'm just going to start looking through. So we had someone who anonymously asked, how do we professionally reinforce the need to be connected to peer support instead of just handing a bunch of resource lists without damaging those relationships? So let me repeat that, and then Kim and Lori, if you want to respond. And this person asks, how can we professionally reinforce the need to be connected to peer support instead of just handing a bunch of resource lists without damaging those relationships? Any thoughts on that, Kim or Lori?
You want to take that first, Lori? You want me to look at it? Because I was going to go back to what you said. The research suggests that in the first 4 weeks post-release, risk of drug-related death is increased. So just like you said, that 2 weeks is an important benchmark. And also that for individuals with substance use disorder, it can be the leading cause of death for individuals. So can you please repeat the question, Melissa?
Sure, and it looks like the person added more context.
Thank you.
How can we professionally reinforce the need to be connected to peer support instead of just handing a bunch of resource lists without damaging the relationships with DOC and other orgs?
So when you say DOC, that's Department of Corrections, correct?
That's correct.
So if I could have my wish, that would be through collaboration and shared decision-making. Individuals who are working collaboratively with individuals, having communication, constant communication, readdressing what it looks like in the community that's where these services are being established. Because I believe in the beginning of the conversation, you said that there were some individuals who are just beginning to implement these kind of services within their states. So communication is going to be key, collaborative communication, participatory process. And I think Lori also talked about, it's also important to honor diversity and cultural sensitivity. Employing a lot of active listening to people who have lived experience, making sure that these individuals are at the table that can facilitate conversation, and also be thinking about the things that we're not thinking about, right? For individuals who may not have experience with it, like I'm a woman in sustained recovery management. I've been in recovery for over 17 years. I had a brief stint with law enforcement, but I didn't have, I was not, I'm very grateful that I did not have to be incarcerated for a longer period of time, but I am equally and doubly grateful for the individuals who are incarcerated with a substance use disorder today, that some of them may have access to these important services. So it's important for us to start thinking on a national level of how we can present these services to individuals. And it all starts with outreach. It starts with collaboration. It starts with being open-minded. It starts with knowing our biases, as Lori mentioned. And it just starts with like having individuals that have this experience at the table. It's also important to have really good supervision for these individuals. I cannot stress that enough. So that they are providing services at a level that at a consistent level across the board, and also in case they start experiencing any challenges. Also, I guess I would have to say along with that would be professional development for the peer specialists, so that they can stay up on the latest trends, on the latest changes, any expected outcomes that are arising with working with individuals who are incarcerated and being reintegrated into society, into their communities. That's what I have. How about you, Lori?
Kim, you nailed it on every set. Like, I can't think of a better, more comprehensive answer. And I the only thing that I would add to that is I haven't read all the chat yet, but I am looking at what Karen said. Resources without case management is an overwhelming mess. It's overwhelming and can be harmful. And y'all, I talked about information being currency on the inside, but Karen is absolutely right. because misinformation is so damaging, and it's hard when you're inside to discern between the two. And I could tell you stories until probably midnight tonight of myths and lists that aren't correct, and teachers in their classroom with a list of resources that is well-meaning, but is probably at least 20 years old. Myths that just propagate and never die. But I just wanted to add that. But other than that, oh my gosh, Kim, you nailed that answer so well. Thank you.
Thank you for that. I was going to point out Karen's chat as well, and case management being such an overlooked resource service, and one that many communities struggle to fund. But knowing, especially in those critical weeks following that release from prison, case management can be not just a helpful support, but a life-saving support. So, so really want to reinforce that. Karen also adding that every resource needs to be vetted. And yes, when I reiterate that. I also know that there are many Department of Corrections, so both prisons, jails, and community corrections agencies that are becoming more and more open to the role of peer support. And so there is an opportunity right now for all of us to start to build on some of that momentum that we're seeing to explain to our partners in the Department of Corrections of how peer support can help them in their jobs, help keep people in the community, and also support the work that the community correction supervisors are doing. So there's an opportunity to do some education there and build those relationships. So we had a couple of questions come up more generally about supporting people. And so one person was interested in some of the differences between working with people who identify as men versus women. And Lori, you've done a lot of work with women, but you know, I think maybe y'all could also, I'm also from the South. I also say y'all, Lori. So the work that you all do with men, but what might be some of the differences we see between men and women at reentry? And what might be some of those critical areas we need to be paying attention to as we, you know, develop and build recovery support services around men and women? Whoever wants to start with that, go ahead.
So if I could just weigh in on this, and I wanted to go back to some things that I saw in the chat. There were some folks who were really weighing in on the go bag that I talked about, and Karen was talking about vetted resources needing to be vetted. And one of the things that we stated earlier is that outreach is important, but it's important for the peer recovery specialists to know that the organizations that they're going to be referring to, right? To know the organizations that they're going to be providing referrals to, or that they're going to be suggesting that their participants get engaged in. So it's important to go back and review those resources to make sure that they're current, and to also make sure that they're continuing to provide the services that they state they're providing for the individuals. Another thing that I've learned working in the recovery space is the participants, right? And the peer specialists, as a former director, like, usually know what's going on in the community before anybody else. Lori talked about information being currency within the prison systems. Information is currency on the streets if you have a recovery community organization. And so peer recovery specialists are usually privy to that information first, right? They will know if they'll know if something is taking place in the community that their participants need to stay away from, and they will know where the new resources are, or new resources that they can use for their participants, because ideally they want to continue to keep these individuals engaged and supported. I also wanted to talk about individuals who are peer specialists. Lori is a role model in her community. And I've spent so much time in Texas over the last 2 months that I feel like I can say y'all too, Melissa. But Lori has been a role model in her community in the state of Texas, peer recovery specialist with lived experience, and I have been blessed to speak to a lot of them over the past few months and few years. And for these individuals, it is such an honor to be able to introduce themselves as in their language, whatever their recovery status or whatever their familiarity is with lived experience. I've heard individuals say, I have 7 years from being affected by the justice and legal system. However, they are calling themselves and the language that they're using to refer to themselves and how they present themselves to others really makes it important for this work that we're doing. Also, as we talked about, making sure that recurrence of symptoms, we stay away from the word relapse, but recurrence of symptoms or return to use, making sure that there are current resources that these individuals can be referred to in case they do need case management, they do need substance use disorder treatment, they do need intensive outpatient, so that they don't have to return to the incarceration system. That's always kind of the goal, is to help them when they're struggling. And here's the hit, right? Here's the biggest hit of all, is even if they do have a recurrence of symptoms, the peer specialist is still there to help them pick themselves back up. No one gets left behind. And that is the importance of these services that are being offered. And so if anybody has a chance to offer them, it's a good idea.
And so I do want to maybe just turn it over to Lori to talk about the gender-specific differences there at reentry, and I know you've worked a lot with women, but also in Kim too, if you have one information you want to input about men, working with men. I think that some of our listeners were interested in some of those critical differences between men and women at reentry.
This is one of my favorite subjects, so I appreciate you bringing it up. And you know, my friends and I started an organization called Lioness, Just Impacted Women's Alliance, and we didn't do it. I have a friend who says repeatedly, we don't hate men, which we don't, but we have a heart for the women that we left behind. And so I have a lot of friends. I have a lot of male friends who have been to prison. I've done a lot of in-reach with, especially through my very best friend who is male, who's in prison right now. And if I could just be so real with y'all, this is what I say about women, although I think that it can be just as appropriate for men too. I say every sad story that I ever hear starts with, there was this man. So what that means in plain and simple terms is sometimes both women and men are very vulnerable to relationships and relationship issues post-incarceration. And I know that, you know, I spent some time in my 20s in 12-step, and I know that there was an unwritten rule, maybe it was unwritten, maybe my sponsor wrote it out, who knows, to kind of put that to the side, and because you are vulnerable. But I've seen a lot of vulnerability attached to entering into relationships too quickly. And sometimes those can be familial relationships that aren't healthy too. I think that women as a whole are more vulnerable to putting themselves in risky situations simply to have an address to parole home to. There are multiple ways and things and avenues for that to happen. And I think that what I've seen is, even though the work can be backbreaking, men normally have a higher level of pay post-release, because there are jobs like construction in Texas. The oil fields are a big one, and those are known to be second chance employers. Typically, I see women mostly gravitating, at least post-release. Their first job is a lot of times service industry. And that's where I get the statistics as far as underemployment goes. So usually it's relationships and the disparity in pay and work that I see.
That is really helpful. Are there any, so Lori, you did mention that men can be also vulnerable in that relationship area. Are there any other vulnerabilities regarding supporting men that we should have on our radar?
I think it just goes back to listening. And Kim talked a lot about listening, and it's not only listening to what's being said, but listening to maybe what people aren't saying, and using your own vulnerability to really connect with people so that they feel comfortable in telling you the truth. Because if you don't have a baseline of the truth in a relationship, it's hard to navigate people and really walk with someone if you don't know where you're headed.
I'm going to say something that, you know, as Lori puts it, to be real. Ideally, if you have the opportunity to put men with men, you put men with men. If you have the opportunity to put women with women, you put women with women. Unfortunately, organizations and programs and peer specialists out there do not have the capacity for this to always happen. And so peer specialists have to be aware of any of the challenges that men may face, or some of the power dynamics that can come up with if a woman peer specialist is working with a man, but and always implementing an individualized approach, right? And that comes from building the rapport. And also, if the peer specialist, here's the thing about great supervision, if a woman is working with a man, and in New Jersey, women work with men. And you know, the women use their lived experience to leverage the information that's passing back and forth, but they also can establish boundaries for themselves, where if they think that the conversation is going somewhere where it does not need to be, or if they're not staying on task with helping this individual in support, because that's what it's about, then they have the ability to share that information with their supervisor to get guidance. Right. So, you know, men have their specific challenges. Men have been affected by trauma. Peer specialists are ideally, they are trained in trauma-informed care, so they can spot when some of those conversations are about to happen. And women have had the same experience. You know, they've had some experiences at the hands of men, at the hands of other women. So peer recovery specialists have to be trained, right, and properly supervised to work with whatever population they're working with, and to understand the challenges that are integral to those populations, whether it's men, women who identify as men, whatever that is. The peer specialists are trained and should have information about working with any population, any gender, and if they feel that they are in a situation that may not be familiar to them or becomes overwhelming, to be able to share that with their supervisor and receive guidance. And just like in the clinical world, right? If you can't work with somebody, if there's some transference or whatever, counter-transference going on, you make mention of that, and then you look for the solutions, because it's always about the person that's being helped. It's not about the peer specialist. It's about the person who's about to be reintegrated into their community. And how best can we serve them? We can best serve them by having the most information that we can on current trends, on challenges, barriers that whatever gender may possibly experience. And then how about this one? I don't know is a complete sentence. I'll get back to you, right? And being familiar and okay with saying that. The individuals, and Lori spoke to this herself, and it was admitted in the chat, authenticity is key, right? So if the peer specialist is experiencing challenges in the relationship that they're trying to build with this individual who's incarcerated, they have the right and the duty, actually, to report that information to their supervisor and receive guidance.
And I think your points segue well into a comment that someone left, saying, Mary McCoy said, we must increase cultural sensitivity and decrease cultural encapsulation. Oftentimes we're so into our own culture, we are blind and only give lip service to cultural sensitivity because we're in a capsule when it comes to our own culture. And she noted this is very common in Western culture. And I think that that's such an important comment, that and really what I think you all are touching on is the importance of the different cultural backgrounds people are coming from, and the different dimensions of diversity that they are representing, and how do we work effectively with them. Is there anything else you want to add regarding cultural sensitivity, cultural responsivity, and I mean, I feel like you've already answered the question, but anything else specific to increasing our own cultural awareness and serving people better?
I like to talk, and I love that. Thank you so very much, whoever made that statement. I think where we are, and I know a lot of agencies, organizations, and a lot of us are in different places with cultural sensitivity. What I like to talk about, what I like to think about is cultural congruence, right? It's being aligned with the individuals who we're serving, being aligned with their cultural values and their expectations. I noticed that there were some individuals here who are, have tribal affiliation, and, being aware of what makes these different cultures tick, right? So understanding that if you're working with someone who's Native, who may be a Native American, right, that they ascribe to rituals and processes, and they look at spirituality different. They're all about the earth. And, sensitivity is one thing, empathy is another. And so we, as trying to enhance cultural diversity is another thing. I think it boils down to, am I aware, and Lori talked about it, am I aware of all the other cultures? Have I done some research? Have I looked into how my Latinx, Latino, and I talked to some of my friends about, is there a difference? So I can say Latino, like how my Latino brothers and sisters, how they relate to different scenarios, how any of our Native American friends and brothers and sisters relate to different kinds of situations, whether they are incarcerated or whether they are in some other sector, is having the resources and having the congruence, right, to do the work and educate ourselves, because you never know who you're going to come in contact with. You never know whose life you may have an opportunity to impact. So the more we educate ourselves on different cultures and how different cultures react to different situations, the better we are prepared to serve the population.
Thank you for that. And I think that really speaks to the importance of having a diverse workforce. And so Recovery Support Services really needing to hire diverse individuals so that we can have that congruence that you talk about, Kim. Lori, anything you want to add to that?
No, again, Kim covered it so very well. I mean, for me, it's always being in a teachable place, hopefully in a teachable place where I think Kim said earlier, I don't know is a full sentence, and I agree. But as far as the cultural congruency and all of the things she said, I couldn't agree more. And I appreciate her wealth of knowledge.
Well, thank you. I appreciate both of you and your wealth of knowledge. Thank you so much for your time today, sharing this information, your experiences, and I know from the chats, many of the folks listening in today also appreciate it. We do have a couple of closing slides, so I want to move on to that. We will want to share the certificate of attendance. So folks, unfortunately, we're going to have to turn the chat off so that we can keep this certificate of attendance accessible to you. But we do have, yes, the emoticons. So welcome any feedback via the emoticons or through our games email if you want to send feedback there. But Ashley Sabatino just dropped the certificate of attendance in the chat. You can click on it there and download that certificate of attendance directly to your to your computer. And it is blank, so you enter your own name in, so that if there are a group of you listening in from one room, just download that one certificate of attendance and you can email it out to your group. Next slide, please. Oh, we have a closing poll, so if you want to provide any additional feedback to games, feel free to participate in that poll. And if you haven't joined the Gaines listserv, Ashley just dropped the link into the chat. So this listserv, we announce all of our webinars. We do a monthly newsletter where we try to feature various programs. And we also will share about opportunities through the Game Center, various trainings, learning collaboratives, etc. So feel free to join there by clicking the link in the chat if you're interested. And finally, if you have any other questions or comments, feel free to reach out to the Game Center. Our website is listed at the bottom of this slide. And we also have a toll-free number listed there if you have questions and want to follow up with the Game Center for more information. We welcome that. And this brings us to the close of our website, our webinar. So thank you again, Kim and Lori. We really appreciate your time and your expertise. Have a great afternoon, everyone.
Thank you.
Thanks. Bye-bye.
Thank you. Bye-bye.